Welcome to another edition of Fast Facts Friday. I'm Josh Droppelman, your Patient Experience Coordinator here at Fairmont Regional Medical Center. We're joined today by Jordan Pickens, our clinical pharmacist, to discuss cardiac medications. Welcome, Jordan.
Hi, thank you for having me.
Thanks for being here. What kind of conditions do people normally have when they're taking cardiac medications?
So most cardiac conditions require medication. Some of those conditions are high blood pressure, heart attack, stroke, heart failure, and atrial fibrillation.
Okay. And what providers normally would prescribe the cardiac medications?
So when you think cardiac medications, you immediately think cardiologist. But most providers can and will prescribe cardiac medications. Some of those include your family doctor, a cardiac surgeon, nurse practitioners, physician's assistants, and other specialists.
Okay. What are some of the reasons why we need to understand our medications?
So 1.3 million people every year are affected by medication errors. Medication errors can be avoided by patients taking an active role in their health and knowing which medication they're on, why they're taking it, and how and when to take it properly.
Wow, that's a huge number.
Yeah.
Wow. Now, would I be able to take herbal supplements when I'm taking some cardiac medications?
So just because things are listed as natural doesn't always mean that they're safe. So before taking an herbal medication, you should always talk to your doctor or pharmacist, because there are some herbal medications that interact with medications prescribed for heart. They can either make the medication less effective, or they could even increase your risk for serious side effects.
Okay. What are some of the guidelines or some safety tips when concerns come into dealing with cardiac medications?
So safety tips for cardiac medications, a lot of cardiac meds cause you to become dizzy when you stand up from a sitting or laying position. So you always want to be careful when doing that. You want to make sure that you have that you're aware that could happen. And then you always want to be aware that a lot of them have bleeding risks. So you want to make sure that you're always watching for signs of bleeding, such as excessive bruising. Then there is also, you want to make sure that you're always taking your medications. You have to be completely compliant on heart medications, or they don't work as well as they should.
Out of all your education and your on-job experience, what would you want our viewers to remember the most when it comes to their cardiac medication?
The thing with cardiac medications, compliance is key. You always want to make sure that you have your medications available and that you're taking them at the same time around the same time every day. To do that, you can use pill organizers. They even make smartphone apps now to remind you to take your medications so that you don't forget or take too many of them in one day. They also when you're planning a trip or a vacation, you should always plan ahead so that you don't run out of your medication on that vacation. When you're starting to get low on your medications, always fill ahead before you're completely out.
What would we do without our smartphones, right? Can't make it through the day. All right, I would like to thank you for joining us today, to giving us some education to myself and also the viewers on cardiac medications. And I would thank you for joining us, and continue to join us for next week for a new Fast Facts Friday.